joining us this morning is Emily Brown, who is with Dr. James Chilcott out there in 193, right?
Yep, 193 North Kingsville.
And you are a nurse practitioner. Explain that. What is a nurse practitioner?
So a nurse practitioner is an advanced practice nurse. So I had my undergraduate bachelor's degree and went back for additional schooling of 2+ years to earn a master's and a family nurse practitioning to diagnose and treat, provide not only primary care but specialty care.
Okay.
And just kind of support the role of the physician as we look into all these new healthcare changes.
How's that different from other nurses, like a regular nurse?
So regular nurse follows with a physician's orders. So per se, I was in the critical care units at Hillcrest Hospital for numerous years, and you are assessing your patients, but then you're going to a provider for those orders to carry out what your patients need. Where this, you kind of encompass the whole thing, and I'm diagnosing and treating everything as well.
Can you write prescriptions? Can
Yes.
you really?
Yeah. Nurse practitioners in the country, it varies state by state. In Ohio, we're still a little bit behind the times. Like Colorado, a nurse practitioner does not need a physician to collaborate with. Ohio, I have a collaboration with Dr. Chilcott, and actually Dr. Choi is on that as well.
Okay.
So there are certain prescriptions that I can write without consulting them. There are other prescriptions where I consult with them before starting or continuing the medication.
So, are you from this area?
I am.
You are?
Born and raised in Ashtabula County.
Really?
Went to Pymatuning Valley
Did you?
School. My husband actually teaches there.
Really?
So.
Now, basically what you're doing then is you're kind of easing the workload for Dr. Chilcott, who's very busy. Very,
Yes.
very busy.
Yes. Nurse practitioners and physician's assistants are in that class of what some will call a mid-level provider, where we're a physician extender.
Okay.
So he's carrying, an active patient load of 3,000 plus, which is only going to get more as healthcare changes. And I can be in there to step in. I am starting my own practice, but then helping him with the overflow. So I'm extending him so that his patients have better access to him.
And obviously then you work right out of his office on 193 there.
Yeah.
Okay, good. What type of educational background and experience is required to become a nurse practitioner?
You have to have a master's degree. So there's numerous different programs with nursing. To get into a master's program, you have a bachelor's initially, and then you move on from there. And it depends. There are multiple, just like with physicians, you can do acute care, family practice, which I chose, pediatrics, gerontology, stuff like that, psychiatric. And then you follow a course of education lasting anywhere from 2 to 4 years to finish out and do your clinical base in that, to make sure that you are a prepared provider when you enter the workforce.
Could you give us a rundown basically of your background and why you did choose to practice in this area and stay home here?
Yeah, I worked actually eons ago at...
You can't be that old.
I'm aging well. But I worked fresh out of high school for Sam Daisley in Andover as a medical assistant and phlebotomist. Worked for University of Pittsburgh in Sharon, Pennsylvania, starting up physician practices, getting them set up for that. Married a local boy, and decided that I wanted to go back to school. So I did my nursing degree, and I knew I wanted critical care. So for critical care, the open heart unit is what I wanted, thus having to travel a distance to get there. So Hillcrest was my choice for that.
Had you always wanted to be in the nursing profession?
Yeah.
Even when you were little? I get that from most people in medical profession, that they started at a young age and really want to pursue it.
Yeah. My dad passed away when I was very young. From a congenital heart issue, and from then on, I thought I was going to be actually a trauma surgeon when I was growing up.
Is that right? Is that right?
And then tweaked that a little bit when I realized that I liked the nursing aspect of it better.
Yeah, Yeah. So you just kind of help me with this a little bit, Emily. Now, so you actually take in patients that you sit with, I mean, and just like a regular doctor
Yep.
would do.
So I have an LPN that works for me, Angel, and she rooms just like any other, like Dr. Chilcott's, medical assistants and LPNs. She brings them in, rooms them, takes their history. Then I come in, and it would be just, similar to him coming in the room. I assess you, diagnose, treat, write you your prescriptions, decide when you need to come back, what lab work you need, stuff like that.
Wow.
If it's a very complicated patient, or if it's something that I have not seen before, our collaborative agreement, so it's just that we have a written agreement that we've decided on. That's the state of Ohio, you have to have that, for what I will go discuss with him. So say I have someone that comes in and their blood sugars are hugely out of control, but they need an antibiotic and they're on Coumadin. So if it's a long-standing patient of his, I may go to him that moment and say, hey, I want to touch base with you on this diagnosis. This is how I'm going to treat. Are you okay with that? Or if it's something, then say he was out of town last week, all week, and I was in the office by myself. So there were a couple that I just waited until yesterday just to consult and make sure that we were on the same page.
Fair enough. Fair enough.
So.
I got to ask you this. I've been having a really bad time with allergies this year. I don't know if it's because of all the rain and stuff. And have you had people call in and say, hey, you're having trouble with your allergies today? And as you can see, I have a little Kleenex here. I have to dab my eyes and stuff. Have you got any?
Yes. I have had more allergies and more poison ivy this year than I have ever seen.
Poison ivy too.
I think it's the mugginess and the wetness. It's just the pollen is sticking to everything.
Yeah, I noticed that the mold count was extremely high.
Yeah, and our winters are changing, so we're not getting the deep cold that we need to kill off everything. So everything's kind of morphing into these super.
What do you do? What do you
allergies.
do for these allergies? Is there anything that you can take or?
Well, I kind of practice more on the old school a little bit.
Okay.
So we always
like
say,
old school.
We always say go back to your grandma.
Yeah.
So, and most nurse practitioners practice that way. We were into preventative medicine. So my husband is a big fan of the neti pot, which I tell him to use.
I've heard about this.
I can't use it. It makes me feel like I'm drowning. But they have wonderful saline nasal sprays that you can use, just a simple antihistamine if you can. So.
The thing I have is with the eyes. I get the itchy eyes and the watery eyes, and then some days it goes away and then it comes back again. It's like.
But really, this time of year, most people are having to be on that have any type of allergies, and I normally myself don't have allergies either. And I found myself reaching for like saline nasal rinses and for like a Zyrtec or Claritin type medication through this whole season. It's not just something that you can take one day because the pollen count's high for weeks at a time.
Right.
But you get sinus infections and you get the irritated eyes from that sitting in your sinus cavity.
Okay.
So if you can flush here, it flushes these sinuses and relieves that pressure on your eye.
Okay. Well, there you go, folks. If you have allergy problems, it's quite common, especially this year, anyway. Do nurse practitioners only work in family practice business?
No.
Offices?
No. I know nurse practitioners are fairly new to this area. We actually have Ruth Simon in pediatrics that's been with the clinic she was a nurse before becoming a nurse practitioner, and she's been with peds for 15 plus years. At Hillcrest and other Cleveland Clinic facilities, it's nurse practitioners, we say now, are a dime a dozen. So every specialist has one. They help extend that practice and get people seen a little bit sooner, because if the open heart surgeon is busy on the table, he can have a nurse practitioner that can actually be seeing patients in his office and routing things. So any specialty imaginable you can go into. I myself chose family practice just for personal preference, that I knew I wanted to come back home to practice.
Sure.
And this is what we needed in this community.
Yeah, you're very right. You're very right. Now, kind of want to break this down. You've kind of touched on some of this stuff, but I want to kind of break it down so folks out there understand it completely. Basically, you can do just about anything as a nurse practitioner. Is that correct? Or are you limited to a degree?
I am limited to what my the physician that I work side by side with can do. So, for instance, if I was with a podiatrist, that would limit my skills to just podiatric care.
Right.
If I was with a cardiologist, what the cardiologist wrote would be what I wrote. In family practice, it gives me that wider range. Dr. Chilcott excises things in the office, does cryotherapy, women's exams, all of that. So I am fortunate that I am able to do all of that.
Okay.
So I would say roughly a nurse practitioner can provide 90% of the care of what your physician can.
And I think you might have kind of touched on this before. Why are practitioners, nurse practitioners, useful in a physician's office? And that's probably to let up on that caseload, right?
To lighten his load for when he has a very, more complicated patient, that he can spend that extra 5-10 minutes with them if I'm in the office seeing,
And he does it. Dr. Chilcott's well known for being very thorough and taking the time with his patients to answer questions and that. My wife goes to him and she says she loves him,
And I think him and I have developed a very good rapport because that's how I am. I think that, you're there, it's your hard-earned money that's getting you there. You're there for a reason, so
right.
I'm going to take the time to make sure that I get what you need.
Sure, that's good philosophy. Now, you mentioned this a little bit, I touched on it a little bit. Does a nurse practitioner work under the supervision of a doctor? You could really go out on your own, right, and do, but if you do, like you mentioned, need some consultation, you will go to the doctor.
Yes. Like I said, it's state-by-state basis. So the difference kind of between a nurse practitioner and a physician's assistant is a physician's assistant is working under the licensure of a provider, of a physician. A nurse practitioner, I carry my own prescriptive authority, my own license. I can practice. There's some financial benefits to being a provider with the clinic, like say ACMC, for insurance reimbursement. But it also gives me that stability of knowing that I have someone that I can go to right away.
Now you work for ACMC, not?
I work for ACMC, yes.
Not right for Dr. Chilcott.
No.
Okay.
I work for ACMC, and then I chose North Kingsville as my home base, and then I have a collaborative agreement. So I have Dr. Choi and Dr. Chilcott both listed on that, so that way if one of them's out of the country or busy with something, and we have a set time frame that I need to get a hold of them. But it kind of gives us that team-based approach where I know that I always have someone out there to reach, and he knows that if he has someone that he can reach out to me to see patients. For example, he was out of the office all last week, and I was able to keep his practice open and see his patients where they would have had to seek alternate sites had I not been there.
Or not make appointments that week.
Yeah.
So you helped out a lot there. Yeah. Really. It's only through ACMC that I have heard of nurse practitioners, because I think we had one on from the actual hospital maybe a year or two ago. I can't remember how long ago, but I never knew they existed. I had no clue. I really did.
Yeah, and that's what I said. In this area, I still have a lot of patients that come in. I always say it's the look-see. So we unfortunately have lost several providers in this area for various reasons, and I have quite a few people that come in and just say, I just wanted to meet you and see if you can take care of me. And I have not had anyone that says, nope, I need to go somewhere else.
I was going to ask you that. Do you run into any kind of situation where, and you haven't.
No, I haven't.
Well, you have a good demeanor. You're very calm and relaxed.
I think that's my critical care background. Or being a mom.
Or being a mom, that could do it too. How many kids you got?
I have one, actually. One? She just graduated from Pima tuning. As I said, I'm aging well. I did start early, but I am aging well.
Wow, you have a child that graduated already. Yeah. I didn't think you were past 25.
Well, thanks.
See? Well, good for you. And believe it doesn't stop at graduation. They continue to be kids to you for the rest of your life. I can tell you that one. Aside from seeing patients in the office, what are the other ways you can reach out to the community and improve public health?
So like I said before, nurse practitioners really try to focus, well, I myself, I know, to generalize, we really focus on the preventative part of healthcare. We don't want to prescribe a medication for this, a medication for that. We want you to make those healthy lifestyle changes that will extend your life and help you not have to be on medications long term. So getting into the wellness aspect of it, and doing things such as, I just did a sports clinical day at Edgewood High School with Dr. Verdon and his physician assistant, actually, Rebecca. And we did, I think we lost count, at noon we had done roughly 120 physicals.
No kidding.
Yeah. So it just gives you that better access. So those 120 kids got seen in the morning. Their parents didn't have to take off the whole day. They came lined up. We had a huge station. The physical therapy department at ACMC did a wonderful job getting them, you know, through their bending and moving and shaking, and then they came into us for the rest of the physical.
I would imagine you are a proponent, big proponent of exercise, walking, that sort of stuff, for better health. Do you do the exercise thing, or are you just so busy that you don't have to?
I will say that I need to get back in it. I think grad school kind of put me off track a little bit.
Yeah, that could happen to anyone.
So and I tell everyone, I said I practice what I preach. So I'm not going to tell you that you have to exercise an hour a day, because I myself have not found the time again to do that.
Right.
Am I trying to balance what I eat? Am I making sure that I park farther away in the parking lot than I could? Am I making sure that I am not mindlessly snacking in front of the TV and just eat in the kitchen? Yeah. So it's the little changes that you can make. That make
you
a
do
big
all
difference.
that. You check that out. You keep.
Yeah.
So you eat healthy then, obviously.
I will not tell you that I didn't eat a brownie last night.
Well, but in moderation.
But in moderation, but yes, I try to eat healthy, try to drink enough water, because water actually, about 80% of the time when you think you're hungry, you're actually thirsty. Your thirst mechanism kicks in. So, so
yeah,
that's the first
I've
thing
heard
that I do.
I've heard that if you drink some water, that will take that feeling away. Yeah, I've talked to a lot of medical people over the last several years, and they've all said, you know, if you're to keep from overeating, use a smaller plate, and sometimes that will help you kind of watch that you don't overindulge.
And we do. Our portions are, especially at restaurants, are just astronomical.
Yeah.
So I usually kind of try to separate and put it aside, so I only eat half of it. Or my husband and I a lot of times will share a plate and get an appetizer to go with it. But just the little things, eating smaller, more frequent meals to keep your blood sugar level, making better choices of having an orange instead of drinking a huge glass of orange juice, because your body utilizes that sugar differently. So
we have a nurse that comes on. She's actually an administrator now, but with Ashtabula Home Health, Regional Home Health, I think it is. Brenda Cobb's her name, and she's went on a diet, and she just was watching everything she did. And I was telling her I was trying to lose some weight, and I go, I find that I can lose weight if I stop sugar. Like cut out the donuts and the cookies, pop, especially because I was a big pop drinker. She goes, sugar is sinful as far as she's concerned. Do not eat that stuff.
Sugar is, I always tell people, like I said, you do it in moderation, but sugar to me is like someone that smokes a pack a day. So it's going to hit similar receptors in your brain that make you want to crave more of it. So the sweeter that you eat things, that's what you're going to crave. It's the same thing with salt. If you eat a lot of salt, your body learns to crave that. It's the same thing with smoking a cigarette. You want another one.
Right.
So if you start to limit that and break it down, I actually have a new onset diabetic that I'm seeing. He's back for his third appointment yesterday with me. He is down roughly 11 pounds in the 6 weeks that I've been seeing him. And we have not had to add additional insulin or medication to his regimen, because he's actually watching. He said, I never realized how much I ate of sugar. And you have to remember your white breads, your pastas, even though it's going into spaghetti, your body uses it and turns it into sugar because it's a simple carbohydrate.
Yeah, I can actually lose a lot of weight if I knock off the sugar. And I just kind of, that's me, and that's not saying everybody can do that.
a soda may have 170 calories but no fat in it, but your body's going to save it as fat.
Mm-hmm.
So
Yeah.
people, when you realize that, you're like, oh. And
Yeah.
diet's not any better, because the diet is
That's what I hear.
it's a substance that your body doesn't know what to do with, so therefore it will still save it in your fat cells.
Mm-hmm.
So that's why I think a lot of children are having problems with obesity, that they're finding studies, because moms are replacing sugar, like sugary drinks with Crystal Light and things like that, where they think it's fine for the kids to drink that all day long, but the body doesn't know what to do with that.
It was kind of amazing. The other day, I did have a donut.
I did too.
Thank you. And you know what? It was because I haven't had one for like 8 weeks.
Mm-hmm.
It really was it was almost a better treat to me that just to have that one donut and not go back and have another one, but it was just kind of neat to have that and
have that little
satisfied me. Somebody mentioned the other day that Gatorade, too much because of the heat and all that stuff, is not really that great for you. Is that true?
Well, you should have a dentist on here to talk about Gatorade.
Really?
That's where they're saying most of the cavities these days are coming from kids drinking Gatorade.
Really?
So you don't need it. If your body will tell you what replenishment you need. If you are out running as a football player on a 90-degree day and you are sweating profusely, yes, you need some sort of supplementation. Should you brush your teeth after you have it? Yes.
Yeah.
As soon as you get off the field. If you are just outside playing in the backyard, just, not drenched in sweat, it's not the best choice for you. Your body wants water because your body knows how to replenish those electrolytes.
My son works in a factory, and he said, Dad, it was like 120 degrees in that thing last week when it was so humid. And he goes, they were pumping us up with Gatorade because I had heard that it wasn't that good for you. Well, I never thought about the teeth angle, I don't know, does it have any other effect that would bother you? I mean, any other...
Well, it's just the sugar. So if he's in 120-degree heat, he may need it depending on how much he's sweating.
Yeah.
But to have it, when you go, it's out. It's this country. It's so hard to eat clean. It's so hard to eat. So I always say try to eat local. Go to your local farmer's market. Go to something that you can get locally that's gonna go bad in a week, because that's what you want to eat. You don't want an apple that can sit on your shelf for 2 weeks because it's been treated with chemicals.
Right.
But it's the same thing with Gatorade. You should never have to be in a grocery store or in a rest stop on the highway and say, oh, I better get a Gatorade because that's what I need. Because you don't need it then. Okay. You only need it if you are sweating profusely.
Good tips. I like what you say about farmer's market. I love this time of year. That's what we do.
I do too. I'm waiting for my tomatoes to turn.
Me too.
My husband is an avid gardener. And,
is he?
And he's got, I think they're about 5'8" tall plants right now of tomatoes.
No kidding. Yeah. It's, I like your philosophy. It goes bad in a week, then that's what you probably want to eat.
That's what you want, because it doesn't have chemicals on it then. I mean, are you in your garden adding, preservatives to your food?
No.
No. Is that what they're doing in a local market? No. But you get, even, your packaged salads from McDonald's and stuff all have, that lettuce has a chemical on it to help keep it from browning.
And then they say there's a lot of calories in those salads too.
It's actually better to eat. Dr. Chilcott and actually were talking about this the one day. We had to choose Burger King for lunch one day, and I got a Whopper Jr. without cheese, and I said that's actually better for you than me getting a salad with that fatty dressing.
Right.
So it was less calories, and I had that with water and an apple.
Yeah.
And it filled me up all day.
Yeah,
Is that the best choice? But no, but there it was a better choice than me getting, a 900 calorie salad.
Right. That's very true. What are your interests, basically? I guess I want to ask you that. It's not only as a medical person, but also in your personal life. Do you have any things that you like, belong to any social clubs or any organizations?
I have all the time in the world to socialize. No. Personal life, before grad school, I was an avid reader, and I also make handmade jewelry.
Do you really?
Yeah.
That's how you kind of relax. It's a hobby.
Yeah. So I'm planning on getting back into that shortly.
You got to. You got to make time for that.
So I'm getting there. It's all about balance. We have but in my practice then, so I like the women's healthcare aspect and preventative medicine, obesity, stuff like that. Just because I want you to live a long time.
That's what you focus on.
Yeah. On
the longevity of people and help them.
Yeah.
Help them out. I know in folks out there that know me, one of Michelle and my hobby is usually in the evenings when we can. And like you say, you got to find time a lot of times for this, but in the evenings you like to sit down and watch a movie and just watch that movie and relax.
Yeah.
And you get away from some of the pressures that you have in your everyday life. She works in the newspaper business, so she's under deadlines constantly.
Yeah.
You know.
We like a good movie. We have our 2 puppies at home, so
Yeah.
we like that.
Is your daughter going to college?
She is. She'll be heading off to Marietta in a couple weeks.
No kidding.
Actually.
Uh-oh.
Yeah.
Empty nest.
I have a 14-week-old Shepherd Lab mix that will.
That'll take up a lot of
it
your
takes up
time.
a lot of that. But
Yeah.
we are excited for her new journey.
Good.
So.
Good. Was she going to be a nurse too?
She's kind of on the fence. She may end up going to medical school. She may go to PA school. She's starting out with biology, and she got into a leadership program there. So leadership and international studies. So she'll travel abroad for a while before she decides what she wants.
Before I let you go, your hours at Dr. Chilcott's, is it Monday through Friday?
Monday through Friday, I'm there 8:30 to 4:30 is my patient schedule. Normally it's a little bit later depending. Yesterday we had quite a few sick call-ins, so I just added them to the end of the day and stayed. And then I'm in the office the Saturday that I'm on call, so roughly it's every 8th Saturday I'm in.
Yeah.
We're kind of still tweaking and seeing what's needed.
Right. How long have you been there?
I have been practicing there since the middle of May.
Really? Just this summer?
Yeah, so just recently.
Well, good. I'm glad you're there to help them out, and I know you will do a very good job. I love your philosophy and wanting to help others. There's nothing better than that, to try to help and make a difference out there. So, Emily, thank you so much for coming in. We went straight through with a half an hour. We started a little bit early this morning, but thank you so much for coming in. Come back and see us again sometime.
I will.